Hi, my name is Alexis Dowling, and this assignment is for course NUR 3065C, Examination and Assessment, Fall Semester 2024. My scenario is patient number 2. I have selected the Lachman test as a skill that I'm going to perform on the patient today. The reason why I selected this skill is because it's going to assess and evaluate the function of this patient's knee, more specifically the cruciate ligament. The information that will be obtained from performing this skill as it relates to the patient's scenario is the patient's knee stability. Performing this test can help guide me in determining the functional status of this patient after their knee replacement. This patient also has a past medical history of polymalacia rheumatica, which can cause pain and stiffness, so assessing knee and joint function is good for this patient. The references and resources that I have selected are relevant to the scenario and skill selection because the Lachman test directly assesses the integrity of this anatomical relation. Wardoni and Covery identify the steps and techniques for performing a Lachman test. Clouet states the Lachman test measures the amount of movement in the joint, comparing the injured leg to the non-injured leg. In Mayo Clinic's article, Knee Replacement 2023, it is mentioned why someone could need a knee replacement. As mentioned in the data collection summary before and mentioned in this article, someone could hurt themselves playing a sport, working out, climbing upstairs, getting out of a chair, even just tripping and falling, and so on. I am now going to demonstrate the skill. Hi, my name is Alexis, and I'm here with my patient who just had their knee replaced. I'm going to perform a test called the Lachman test. This will help assess the stability of your knee today and to see if there is any ACL tears or damage. So first we'll have the patient lie flat on their back like so. So the patient's going to be completely flat. Their leg and knee needs to be completely relaxed before we begin. They're in the correct position with them flat on their back, supine. We want to make sure that we flex the knee about 30 degrees like so. So I'm going to place one hand here on your femur. The next hand is going to be placed here on your tibia. I'm going to slightly rotate it just a bit. Next, I'm going to firmly pull it up. I'm going to have a tight grip here on your femur, and we're going to pull this tibia up. As I pull it up towards my chest, I'm looking for the amount of firmness on the end point. And since there is no firmness and no excessive movement, this is good, and it's suggestive that everything is intact and the surgery was successful. You want to make sure to compare both sides, so you want to compare both knees just to make sure everything is the same. So again, that's here on the femur, one's here on the tibia, and you quickly pull up towards the chest. And again, we compare both sides. So flex 30 degrees, rotate it a bit, and quick movements up to the chest, looking at that end point and firmness.